All right, guys, I'm back. And in this video, we're going to talk about the 15 reasons why you may not be losing on a low carb keto plan. Okay. Number one, you are losing, but you don't realize it because your muscles are repairing. Okay. Now, weight loss is not the best indicator of getting healthy. And the principle that you have to really get is that you have to get healthy to lose weight, not lose weight to get healthy. So the best indicator of health is energy level. It's the cravings go away. You're no longer hungry versus just losing weight. In the reparative actions, when your body actually heals, you have all sorts of proteins replacing other proteins, and you may have atrophy, which is a loss of muscle, which needs to be replaced. But when you take the situation where your weight loss is stopped, really focus on, are you losing inches, okay? So you're shrinking, but the weight of the muscle is making you look like you're not. All right. So, number two, you are eating too frequently just because maybe you haven't done intermittent fasting yet. This is a very, very, very key thing right here. I can't emphasize this enough. Intermittent fasting is probably even more important than keto, okay? As far as health benefits. So we don't want to do snacks. We want to go less frequent. You should be eating 2 meals, and some of you, maybe 1 meal with no snacks. Okay, number three, your carbs are too high. If your metabolism is slow, if you're going through menopause, if you have a thyroid problem, you need to go down to like 10 grams of carb or less. Just because you have to do it because the metabolism is slow, so we reduce the carb, we make it easier to get the weight off. Okay, number four, doing keto partially. So many people, when I talk to them, you ask them, are you doing keto? Yeah, I'm sort of doing it. And then you find out they're not really doing it like they should, or they're having cheat days on the weekend. That's going to really shut down your results for not just for a day, probably for several days. And if you're cheating every other day, you're not going to see the results. So you just need to do it perfectly. That's all. All right, number five, sugar alcohols. These are alternative sweeteners that can cause disruption in your gut, in the flora, because some of them act as a fiber, and you can retain fluid. And just that digestive stress can keep you from losing weight, so just make note of this. But a lot of people, when they start out doing keto, they need this because they don't like to give up their sweets. So they have a dessert replacement. All right, number six, stress. That includes losses, trauma, surgery, okay? Because you're going to spike cortisol, and cortisol turns your muscle into sugar, which then raises your insulin. Number seven, sleep. If you notice, when you're not sleeping that well, your hunger goes up, your blood sugars go off. So a lack of sleep will totally keep you from burning fat. Number eight, your fat's too high. Now, in the beginning, you want to increase your fat because you want to be able to make it from one meal to the next without getting hungry. But as your body adapts to fat burning, you want to cut down your dietary fat to force your body to burn its own fat, okay? All right, number nine, your protein is too high. Too much protein will stimulate insulin and keep you from losing weight. A moderate amount of protein will not. Okay, 10, dairy and nuts potentially could create inflammation in your digestion, in your gallbladder, and your colon, and that inflammation can keep you from losing weight. All right, number 11, your vegetables are too starchy. You may need to avoid squash or peas or pumpkin or carrots or even tomatoes and beets. You might want to stick with the leafy greens if your metabolism is slow. Number 12, medications, especially those medications that are anti-anxiety, antidepressive, antibiotics. There's so many different medications that will keep you from losing weight. Why? Because they stimulate insulin. Okay, 13, you're not exercising. You need to exercise. Everyone needs to exercise. All right, 14, you're over-exercising. You're doing too much and you're not recovering. I remember a patient in practice that came in and she was working out, I'm not kidding, 6 hours a day. She was working out 6 hours a day and she was concerned because she wasn't losing any weight. So we cut it way back, okay, to an hour, and then she started losing weight. I had another guy come in. He was working out every day. I switched him to 2 times a week. And that was the only thing that helped him lose weight. So if you're getting sore, if you're getting tired, don't exercise on top of that, okay? Because the benefit of exercise is in the recovery phase after you're working out. So you don't want to overtrain. Number 15, restaurants. This is the crapshoot because you don't know what you're getting. You got hidden sugar. You have different oils like soy oil, which is high in omega-6, that are in the sauces and the dressings. You just don't know what you're getting. So if you're going out to dinner too much, this could throw you off. All right, guys, there you have it. The 15 reasons why you may not be losing on keto. All right, number 11, vegetables too starchy. What, are we at a dog park in here?